All right. Thank you all for coming out to learn about this very important topic, and thank you, Dr. Garrett, for the invitation to speak. So there is a medical definition of stroke, but really all of us should actually be able to recognize the most common signs of a stroke happening. And really a stroke on the outside is a sudden problem with speaking, moving your arm or leg, walking, or seeing. And so that's what we can recognize if we see someone who's had a stroke or having a stroke. What's happening on the inside is that there's an injury to part of the brain that's really due to a problem with a blood vessel. And there are two kinds of stroke. So the first kind is called an ischemic stroke. And this is a CAT scan picture of a brain. And you can see there's a part of the brain that I'll tell you is very dark and abnormal. And this part of the brain has actually died, and that's due to starvation of oxygen and nutrients due to blockage of blood flow to that part of the brain. There's a second type of stroke, which can have the same symptoms, but is caused by a different problem inside. And that's a hemorrhagic stroke. And it's called hemorrhagic because there's actually extra blood or hemorrhage in or around the brain. And this white area in the CAT scan is that extra blood. And so most hemorrhagic strokes are due to a blood vessel that is actually burst open and leading to this extra accumulation of blood, which then presses up against the brain tissue around it, causing direct injury and also leading to starvation of that area of the brain. So about 4 in 5 strokes that happen are this ischemic type, and about 1 in 5 are hemorrhagic. Now, this is probably the most important slide for the evening from my perspective, which is that all of us, every single one of us in the audience, every single one of us in the community should be able to recognize the most common symptoms of a stroke. So the American Stroke Association has promoted this FAST campaign. So the word FAST, the letter F stands for face, meaning a droopy face. A stands for arm. So weakness of the arm, so the arm falling down by the side or trouble using one arm. S stands for speech, so difficulty speaking, either getting the words out or slurred speech, or difficulty understanding someone else's speech. And then T stands for time to call 911, because that's the most important thing to do if you see someone who's having stroke symptoms, is call 911 so they can get the best treatment possible as quickly as possible. So those are the most common symptoms of a stroke. There are other symptoms of stroke, including changes in someone's vision, loss of balance, difficulty walking, loss of coordination on one side, and strokes can even cause a sudden coma or unresponsive episode. So why is stroke so important? Well, 1 in 5 women and 1 in 6 men will have a stroke at some point in their lifetimes. And really that means it's so common that all of us really know someone who has had a stroke or someone who will have a stroke. It's the 5th leading cause of death overall in the United States, and it's the 4th leading cause of death for women. And it is also a major cause of long-term disability because some people are unfortunately left with permanent symptoms that impair their ability to walk, talk, and handle their own affairs. And unlike some medical problems which sort of stand by themselves, stroke is associated with a lot of these other medical problems that can also have significant effects. So what directly causes strokes? Well, strokes can come from all sorts of reasons. That typically often come from a problem with the heart, a problem with the blood vessels in the neck or in the head, but those problems can be caused by infection, they can be caused by use of substances like cocaine, it can be caused by irregular heart rhythm, or even cancer can predispose someone to having a stroke. So it's very difficult for us to say ahead of time what any one person's stroke is going to be due to, but instead we're able to predict someone's risk of having a stroke by looking at what we call stroke risk factors. And some of these factors are fixed, meaning they're not ones that we can really easily change. And that includes age, our sex at birth, race, ethnicity, family history, and prior stroke. And you'll notice a lot of these are the same risk factors we just heard about in terms of being associated with high blood pressure. The other category of risk factors are these modifiable ones. So these are things which we can actually attempt to influence, and they include blood pressure, diabetes, heart disease, our cholesterol profile, the use of tobacco and alcohol, and our physical activity, weight, and diet. So of all of these, blood pressure is actually by far the most important stroke risk factor. And if we were able to get rid of high blood pressure, we could potentially prevent at least 50% of strokes around the world. And so this relationship between stroke and high blood pressure has been demonstrated in a large number of scientific studies. I just put the graph of one of the studies up here. And for each level of blood pressure, as your blood pressure rises, your risk of stroke increases. And this is sort of true over a very wide range of blood pressures. And at least in this study, every 12 to 13 millimeters of mercury increase in your blood pressure resulted in a doubling of the risk of stroke. So there's a very strong relationship there. Now, why is that, or why do we think that happens? Well, we know that having high blood pressure in the long term damages these blood vessels or arteries that carry the blood to the brain. And it can damage them in two different ways. So if this is a blood pressure like a tube carrying the blood, you can see that there's a bulge here. So blood pressure can directly weaken the blood vessel walls, which can eventually lead to rupture, and that can cause a hemorrhagic stroke. The second way of injuring the blood vessel is that over time, plaque can build up inside the walls of the blood vessel. And this plaque will eventually lead to blockage or can directly cause a blood clot. The other thing that could happen is in the long term, high blood pressure can damage the other organs that are also very important, and particularly the heart and kidneys. And so damage to the heart can then predispose to stroke that happens because of blood clots forming in the heart. So what does this mean for you and for me? Well, fortunately, we also know that lowering blood pressure is directly able to prevent stroke. So a number of different studies of different medications and different treatments have demonstrated over time that we are actually able to reverse this high risk of a stroke that comes with high blood pressure. And so this is one of the things that we do focus on a lot if you've had a stroke. And so if you've had a stroke, really you, your stroke specialist, your primary care doctor should all have an agreement about what your blood pressure target is. And I will give you one specific goal, but really often that target is individualized, and it also may depend on what your blood pressure usually is, what your arteries, your blood vessels look like, and how far out from your stroke you are in terms of your recovery. I strongly encourage everyone who's monitoring, who needs to treat their blood pressure, to keep a blood pressure journal. I think this is very useful to take your blood pressure, ideally to have a blood pressure cuff at home, take your own blood pressure. You can take it a couple different times of day. I don't think you need to take it every day or twice a day, but taking it a couple times a week or at least once a week, you want to have a journal and you can track yourself over time. And the reason why it's so important to do this is it's really an ongoing process to get your blood pressure to the right place and keep it there. And I mentioned earlier that age is a risk factor for stroke, and we've heard it's a risk factor for increasing blood pressure. So even if your blood pressure is good now, if you didn't measure it for the next 5 years, you might be very surprised at what happened in that intervening time. So if you're looking for one number that we often say, so after a stroke, is we really actually want your blood pressure to be fairly normal. And so back to that less than 130 on the top number, less than 80 on the bottom number. Now, if you've never had a stroke, we know that if you have particularly elevated blood pressure, we can help prevent stroke and heart disease. If you have very mildly elevated blood pressures, the sort of benefits of aggressive treatment really depend on your personal risk of stroke and cardiovascular disease. And that's something that your primary care doctor can help work out with you. If you have other medical problems like diabetes or you already have heart disease, then your blood pressure goals may be particularly lower than they would be otherwise. So we've heard a lot about how to lower blood pressure, and it's really I'm not going to bring up anything new in this list. I will say there are some medication choices that may be a little better if you've had a stroke, and others that may be not quite as good. But really, it's the impact on your blood pressure that's the most important part about these choices. I will mention that treatment of sleep apnea can help to lower blood pressures, because if you have sleep apnea, it's very stressful in your body. There's often your blood pressures are running quite high in the middle of the night while you're asleep. And there's at least a couple of studies that have showed that meditation and mindfulness can actually help to also contribute to lower blood pressures. So I did want to bring up some of the barriers to lowering blood pressure, because if it were really easy, then we'd all have normal blood pressure. So one is the problem of medication side effects. And I think one important thing to know about blood pressure medications is there's a large number of different brands, different kinds, and different categories. And so there's such a large number that you really should be able to find one that works for you with minimal or tolerable side effects. Another thing is cost. Another area in which we're fortunate with blood pressure medications, there are many generic and quite easily manufactured medications to choose from. So this is not one of those fields where you should be paying $1,000 to get your blood pressure lowered. So pill burden. So I think one thing that people always say to me when I see them in the office is, well, but I'm already taking this number of pills at night, I really don't want to take one more. And I very much understand that. I think it's important to know exactly why you're taking every pill that you're taking, and that you should feel like they all have a reason. And sometimes it's easy to get lost in that. And your doctor should be able to help you know, this is why I'm taking this pill. Medications for blood pressure do not make you feel better. You're not taking them to alleviate pain or to improve anything in particular other than to prevent these terrible things from happening. So it's sometimes hard to motivate to take a pill to prevent a problem, but that's really what these are for. I think I mentioned earlier it's important to realize that there is this need for ongoing monitoring, and so that once you achieve your goal blood pressure, that's great, and it's a great sign that you're going to be able to keep it in the goal in the future, but you do need to keep checking it. Another barrier is just the challenge of scheduling appointments and making time out of your schedule, having your primary care doc make time out of their schedule so that you can both together continue this process. And that's something where I would say if you're there for a follow-up, make sure that you know when your next follow-up is going to be, and also make sure you have a plan for what happens if your blood pressure is not where it needs to be in a couple months, but you aren't scheduled to see them yet. So we talk a lot about diet and exercise and weight loss, and it's very easy for us to talk about it, but you'll notice that not all doctors look like they're able to run a marathon. So it's always a personal challenge, and you have to kind of individualize your approach to eating healthy, exercising, and losing weight. And so I think one of the last topics I wanted to touch on is sometimes people say, well, what if my blood pressure is too low? Now, sometimes this is a happy problem from our perspective, but it does raise this concern. Low blood pressure can have side effects. These are typically things like very prolonged dizziness upon standing, very limited ability to exercise, or very severe fatigue that happens when you take your medicine. But low blood pressure can also cause episodes of neurologic symptoms depending on your anatomy of your blood vessels. Those would be reasons why blood pressure would be too low. We have to acknowledge that if we're being appropriately aggressive about treating blood pressure, we run this risk of side effects, but that's something that, again, you should talk to your doctors about, and we should be able to adjust the medications. And blood pressure that's too low could have impact on other organs. But in general, just to give you a sort of sense of numbers, I think most people feel perfectly fine when their blood pressures are in the 90s to 120 range. And so if it's just a number and you're feeling fine, I would not consider that too low. So to sort of summarize my points, blood pressure is a very important predictor of our risk of having a stroke, but very fortunately, it's a treatable predictor of risk, and so we're able to reduce this risk. I think it's always important to have an individualized target in mind based on your own medical history and your future risk. And We always want to be preventing a stroke rather than attempting to treat one that's in the process of happening. I encourage you to call 911 at the first sign of stroke, and just remember the American Stroke Association's FAST campaign, face, arm, and speech, and don't delay, because we have treatments. They're much more effective within the first few minutes or hours after a stroke starting. And I'd just like to thank the Christiana Care Stroke Program and put up a couple of resources if you have more questions about stroke or blood pressure that we don't address at the end of our session. So thank you again for your attention.